All right, guys, that's right. I'm down here on the floor saying hi to you guys. We are gonna go over how to use these tac balls for your lower back. It's one of the most common complaints I have in here. Now, before you jump into rehab on this stuff, make sure you check out the videos about lower back pain and when you have to do the rehab. There's a certain time for this. If you take one of those hot discs that are coming in your office and they can barely move, and you try to get them to do this thing, you will never see that guy again. All right, and that's as a clinician. If you try to do this stuff as a patient thinking, I need rehab, I need to get better now, you're not gonna get up off the floor. This is for when you're feeling pretty good. There's still a little bit of soreness in there, but take care of stuff in the right order. I've got a really good video about lower back pain you need to look at to make sure you're not having like a disc reaction. This is not for that. So anyway, you can see I've got the tac balls here, and there's 2 of them, and they sit inside that little baggie. If you remember me talking about these things when we were talking about the upper shoulders, they really, really work well on skin. So if you have the chance to do this at home in the privacy of your own place, definitely get this on your skin. They're very good through this little mesh bag, but you're gonna wanna take it off. Now for the video, I'm keeping my shirt on, okay? So what you're gonna do is you're gonna lay down with your spine sitting between those 2 balls. It's gonna comfort that and catch it, all right? So I'm gonna stick it underneath my back, right on the spine there, and get it kind of adjusted. Now it's the same 3 rules that I used for my shoulder. So to review them, rule number 1, get just the pressure off of there. So you're doing a direct trigger point compression. I'm not doing any activity. The thing is, when I do these seminars and I give someone one of these balls, the first thing they start doing is just rocking back and forth. Oh yeah, it feels good, that feels good. There's a better way to do this. The whole idea with this whole Chad knows Rehabtogo is there's a better way to do stuff. So let's do it the better way. So you want about 20 to 30 seconds of just letting that back sit on that. You're releasing the trigger points. You'll know when you're able to handle the next step because you'll be able to lay your legs flat all the way down without like cringing. Right? So you can tell, like I started, my legs were bent and I'm on my heels, and I can kind of control how much pressure I have down here. If this is unbearable, you can still do this same treatment in a standing position on the wall, similar to how I did the shoulder. But stage 1 is just trigger point release. Stage 2, now we want to get in there and start kind of doing the massage. So I'm going to start with a side-to-side rocking motion. I'm going to go up and down. But remember my rules with this. People and patients and doctors tend to just go the way it feels good. The muscles run very linear. The fascia is very spiderweb shaped. So make sure you're not stuck just going back and forth or side to side. Get the twisting in there. Get the circles in there. Get the diagonal tugs in there. Everything is built to slide and glide. Fascia is built to slide. You need to create slide and glide in every direction. The 3rd step is now to pin the balls back underneath that tight area, that trigger point, and now start movements. So I'm doing leg movements, right? I'm doing pelvis thrusts. Obviously, I'm not doing this in the gym. I'm gonna do this at the privacy of my own home. It may be a bench press motion. It may be a sit-up type motion. It might be reaching across your body. You have to figure out where it's restricted and what activity helps loosen it up. That's how you use it. They're that simple. I always tell my patients and I tell my staff, make sure that you're doing these in about a 2.5 to 3 minute time frame. This isn't lay on these things for 50 minutes and see if it loosens up. We're not trying to punish your body until it's so painful you can't move the next day. Anytime you get in there and do anything on the lower back, it's going to feel good because blood's gonna come to the area. But we have to have a reason why we're doing stuff. And the reason why isn't to punish our body. The reason why is to release this tight, restricting, adhered fascia so that you can start to move better. And that should be done very quickly. My protocol is typically to do this thing once or twice a day, a couple of minutes at a time, and you may do it for maybe 10 days. But if you're not seeing significant results in 3 or 4 visits, you're probably doing something wrong, or it's an inappropriate treatment, or you're using something wrong like lacrosse balls. I know lacrosse balls are cheap, so are these things. Get the ones that are built for your body and do stuff the right way. That's how you release the lower back, and you should be kind of seeing a recurrent theme here. The way I did the shoulders is the same way I do the back. The way I do the elbow is the same way I do the shoulders and the back. The same way I do the hips and the glutes. And other than the plantar fascia on the bottom of your foot, all of these tac ball type releases are the same 3 steps. Trigger point, move and massage, and then pin and stretch, move the joints. Hope you guys liked that one. Nice to see you way down here on the floor. Get down and get moving a little bit. It's good for you. Hey guys, Dr. Chad Peters back here again. If you like that content, if you like the way I deliver this stuff, or if you have questions about what was on, don't hesitate. Comment below and go through. Tell me what you liked, what you didn't like, what you disagree with. Let's have a conversation. The entire idea with this is that we all get better when we start discussing things. I'll see you soon.